What are the indications of a successful hair transplant? I am 10 days post-op, 5,200 grafts. Though I know I have to wait for 6 months to see the results, is there any indication that I had a successful surgery? 6 months is a long time to wait for an answer.
Thank you for your question. You submitted your question with the photo of the top of your scalp, and you state you're 10 days after undergoing 5,200 hair grafts. And you're looking for some kind of indication of a successful surgery, and you were advised that you would not get any sense of the true success of the surgery for at least 6 months. And you're posing a question to see if there are any other ways to know if there was a successful outcome, as 6 months is a long time to wait. Well, I can certainly share with you how I have counseled my patients when I was doing a lot of hair transplant surgery, as well as patients who we treat with non-surgical solutions in our practice every day. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed that derived from hair transplant surgery to maximize the outcome and the success of the surgery using a material called extracellular matrix and platelet-rich plasma. And we've been helping people from around the world non-surgically for male and female pattern hair loss, in addition to people who have undergone hair transplant done elsewhere. So as far as the healing process is concerned and the outcome is concerned, you have to unfortunately deal with the reality that it does take time to watch to see how many of those grafts that were placed actually grow. In general, I would say that 6 months is being kind of optimistic. You really are going to have to wait about a year, and in some people even longer. But most people, most of our colleagues in hair transplant surgery would state that 1 year is the right time to get a sense of the full expression of the hair graft as well as the growth of the existing hair. One of the things that people don't always appreciate is that in addition to the shock loss of the grafts, there's also shock loss of existing hairs. And it depends on how advanced your hair loss was at the time of your surgery as to, in terms of the density of existing hairs. Further, I would say that we have been able to appreciate a strategic application of our hair regeneration technology for patients who have done transplants elsewhere. Just a little bit of more detail about hair regeneration. This was derived after we were doing a lot of transplants and we were wanting to see, as you do, the most optimal outcome, which is the growth of every graft that was placed. Hair transplant, as you have experienced, is a very tedious procedure, and you want to see every graft grow. So we used a material called extracellular matrix and platelet-rich plasma, which is basically a regenerative medicine technology to help the donor area heal better, as well as the grafts to heal better. Well, a nice side effect was that thinning hair got thicker. Further along, we were able to then develop a system to help people with both male and female pattern hair loss who would be not necessarily good hair transplant candidates, but were progressively thinning, and use this technology to help people get thicker hair. And basically what we're able to do is reactivate hair that is not growing, thicken thinning hair, as well as prolong the lifespan or growth cycle of a thinning hair. Over the course of 7 or 8 years, we've also developed a classification system looking at gender, age, age of onset, rate of progression, degree of progression, and other medical factors and other issues related to previous hair treatments. And we've even been able to make even more distinctions and improvements in a system to help people with their progression of hair loss. Now, in addition, as I mentioned, we have patients who come from all over the world who will come to us within the first 3 months of having a hair transplant. And we've been able to demonstrate that with the stem cell-based technology, we can actually expedite the regrowth of transplanted hair. Further, we're able to thicken existing thinning hair and essentially help the healing process. So we've been able to do that, and I'm not saying this is necessarily critical for you to do, but it is something that we talk about to our patients who are considering hair transplant. And we describe the scenario where during this healing process, this stem cell type technology seems to have a way to improve the trajectory of healing. But to address your question, you have to basically look at it in stages. You look at the progress of healing in stages. Wound healing is, regardless of the type of surgery, takes about a year, whether we're talking about cosmetic surgery like facelifting surgery or hair transplant surgery. Wound healing takes about a year. You go through 4 different phases. You go through a hemostatic phase, inflammatory phase, proliferative phase, and then a remodeling phase. And all of those phases are part of nature and is part of the process. Now, your doctor can probably suggest to you ways to help you with long-term management of your hair loss progression. If you had, basically I can infer that if you had 5,200 grafts, then you probably had fairly extensive hair loss. So you also want to think about what's going to go on beyond your growth of your grafts and what's going to happen a few years later. So you have to think of long-term strategies. This is something that a lot of people don't appreciate when they do a hair transplant. They think of it as a one-off procedure, and then they expect that they won't continue to lose hair, which is absolutely not true. Everyone will continue to lose hair. It depends on the individual's rate of progression. So it is important for you to, at least by asking this question, learn about options for prolonging the lifespan of your existing hair, the hairs that were grafted, and think about the long-term management, whether it's the use of pharmaceuticals such as finasteride, minoxidil, whether it's regenerative technologies such as hair regeneration, as well as future transplantation. So I hope that was helpful. I wish you the best of luck. Thank you for your question.